Hey, good morning, everyone, and welcome to the, well, man. Hey, good morning, everyone, and welcome to the UroPatient podcast. I'm your host, Vic Senese. Glad to have you here today. If you're watching us live, you're watching us on YouTube, LinkedIn, Facebook Live, X, or Kick. Welcome to the show. We come there all the time. Hey, for those YouTubers out there, be sure to hit that like button. It really helps our numbers go up better. So numbers are good. This is your first time joining us, go to UroPatient.com, the best place to catch all of our past episodes, learn more about the website, and find all sorts of stuff. We got a bunch of past episodes up there for you, so be sure to check those out. Also, we have a whole bunch of these nice, helpful handouts on our website. Download them, bring them to your doctor's appointment. They're perfect for that. So this week, I'm joined by one of our other podcasts. Dr. Jeff talks about sex and intimacy. I have the host of that, Dr. Jeff, joining us. His website's drjeffsextalk.com. It's every Tuesday at 7 p.m. So let me tell you a little bit about Dr. Jeff. He's a board-certified advanced practice urology clinical nurse specialist, nationally recognized researcher, and author based in Chicago. With over 30 years of experience caring for individuals with sexual dysfunction, Dr. Albaugh has dedicated his career to improving the sexual and emotional well-being of patients facing urologic and pelvic health challenges. He is the host of Dr. Jeff Talks About Sex and Intimacy, where he brings thoughtful, evidence-based conversations to light, helping individuals and couples navigate complex topics with compassion, honesty, and hope. Let's bring in Dr. Jeff. Jeff, welcome to the show.
Thanks, Vic. Thank you so much for having me, and especially to talk about this important topic.
Yeah, it's really great. I think that a lot of patients need to know more about their sexual health, and who better than you? So let me bring up your slides and take it away.
All right. Well, I think it's great that we're talking about this topic today because it's a topic that I know is very, very important to men with prostate cancer. So we're going to have a real conversation about recovery and intimacy after prostate cancer treatment, especially surgery. So we're going to look at the facts, we're going to look at the evidence, and hopefully give you the information you need to move forward in the best possible way in your healing process. So, as Vic said, I do have the podcast where you can go learn so much more about all kinds of different things to do with sex, intimacy, and relationships. And also, after surgery or before surgery, you can download my book at drjeffalbaugh.com. It's free. My patients gave monies for my research and also for that book. It's the second edition. You can get the first edition too, but I would recommend the second edition, which contains the patient's voice from my research and has perspectives from patients in addition to what the first edition had and some updates. So I hope the book helps you. I think it may. It's called Reclaiming Sex and Intimacy After Prostate Cancer. I wrote it simply to help men understand better a lot of what we're talking about today. So, all right, how does prostate cancer treatment impact sexual function? Well, the most common side effect, whether you have surgery, whether you do radiation, whether you do hormone ablation, which is reducing testosterone to manage the prostate cancer, any one of those treatments will impact your ability to get and keep erections, which is erectile dysfunction. Ejaculation does not typically occur. The fluid does not come out. The sensation occurs, but we'll talk more about that later, how that may change. But the sensation occurs while the fluid doesn't come out because that fluid comes together in the prostate and then is expelled out of the body from that prostate, which is no longer in your body after you've had surgery. Or if it's been radiated, it's no longer functioning. So usually you don't ejaculate fluid after you've had prostate cancer, surgery, or radiation. The penis may seem to sort of go up into the body, like it disappears up into your body. Some people call that penile shrinkage, but basically it feels like, where did it go? What happened here? And that can be a frustrating problem too. So these factors can impact how you feel about yourself and your body, and it can also impact your quality of life and your relationship with your intimate partner. So that's why we're here today talking about this important subject. I'm so glad you tuned in to learn. So let's look at the facts, because you don't need to hear what I think about anything. What you need to hear is what the research and the science says. And over throughout the decades, whether it's open or robotic, radical prostatectomy, removing the prostate to remove the cancer within the prostate, causes erectile dysfunction. When we look at this study, the first one listed here, 80 to 90% of patients reported erectile dysfunction, and it decreased. That was right after surgery, so pretty much almost everybody. And then it decreased to about 60% after 2 years after the surgery. And that's compared to men. Only 15% of those men had problems before surgery. So this is men who were functioning well before surgery, and after surgery, 80 to 90% of them were struggling with erections. And even 2 years later, 60% of those same men were still struggling with erections. And that's a little bit newer study, more recent. But when you look at that study that kind of pulled the information together, that gives you that information, which is very similar to previous studies. This second study that I mentioned here had almost 1,300 men in it, and they found 2 years after prostatectomy or prostate surgery, 78% of men were struggling with erectile dysfunction, and even 5 years later, 72% of men were struggling with erectile function. And then again, another study there listed at the bottom. Over and over, you hear these same statistics. 78 to 87% of men, 2 to 15 years after prostate cancer treatment, with surgery, radiation, whatever, they were struggling with erectile dysfunction. So it's really prudent to remember that sexual dysfunction is the main long-term side effect that occurs after prostate cancer treatment. And that's why we're here talking about that today, very frankly and very honestly. So why do you see such discrepancies or hear such discrepancies from urologists or patients or whoever? Well, it all has to do with how you measure erectile function. If you ask the men directly, who know exactly whether their penis is functioning or not, these studies use those type of parameters. They ask the men directly, and the questions got to the point of, are you able to get or keep an erection sufficient for sexual intercourse or sexual function in the way that you're trying to do it? This is really what we want to know. And the men reported what you see here. So most men are struggling with the ability to get and keep an erection sufficient for sexual performance, including intercourse, after prostate cancer treatment with surgery. Men who've had radiation also complain of these same things, although it may not be as severe. When you look at the studies, pretty much just as many men struggle with erections after radiation as do with surgery, but it's not always as severe. So don't get confused by that point. But today we're focusing a little bit more on surgery in particular. So what happens after radical prostatectomy? Well, it's a triad of 3 key factors: neural injury. Why? Because literally, when you take the prostate out or remove it, you have to peel the nerves off the bottom of the prostate. That's the only way to get it out. Those nerves were never meant to be touched. They become traumatized, they become inflamed, and they stop working properly. We call it neuropraxis. They're there, but they're not working. You may even feel like, did they really spare the nerves? I don't think they're really there. Typically, most surgeons who've done the surgery for years and really are good at the surgery do an excellent job of preserving the nerves, but they were never meant to be touched, and they are traumatized and inflamed. It can take up to 5 years and an average of 2 years for the nerves to recover after prostate cancer surgery. And when you look at men who had really good erections beforehand, still only about 25 to 30% of those men 2 years later will say they're back where they were before. So most men don't feel like they got back where they were before in terms of ability to get and keep erections when they're having sex. So neuronal injury, nerve damage, is number one of the triad. And that also, the blood vessels have to be peeled off of the prostate to get it out. So vascular injury is the other thing that happens. So the two things that are essential for an erection: when you get excited and it's all put together in your brain, the message goes down your spine to the peripheral nerves. Peripheral nerves come off your tailbone, wrap around your prostate, bundle on the right, bundle on the left, and go to your penis. When the signal gets to your penis, it activates neurotransmitters and chemicals in the penis that cause the smooth muscle to open up or relax, and you get 7 or 8 times more blood in your penis. So to put that together, you need nervous conduction back and forth between your brain and penis, and you need blood to engorge or fill your penis to make it hard. So nerve damage and blood vessel injury and lack of blood flow are two of the key components of what causes erectile dysfunction after radical prostatectomy. Finally, with that lack of nervous input to the communication between your brain and penis, telling your penis that it needs to fill with blood and get hard, and the lack of blood flow to your penis as well, that causes smooth muscle changes and damage. The structures in your penis over time may change. And that's why sometimes men will report it seems like the penis is smaller or it's changed afterwards. So we think that's because of muscle atrophy, muscles kind of shrinking back or changing from lack of muscle activity. When your penis fills, the muscles relax away from the blood vessel and the blood vessels fill. When after you're done with an erection, the smooth muscle relaxes back down around that blood vessel. It moves back around the blood vessel and the blood moves out. So smooth muscles relax away and then they come back around the blood vessel. And that activity is muscle activity, just like when you move your arms and legs and other muscles. When you stop moving those muscles, atrophy or changes and damage can occur. So nerve damage, blood vessel injury, and not as adequate blood flow, and finally smooth muscle changes or muscle atrophy. That is the triad of what causes the problems with erections after prostate cancer surgery, and sometimes after radiation as well, as we said. So what about orgasm or climax? What does the research say about that? Well, climacturia, in other words, you don't get that climax sensation at all, was reported in 23% of over 3,000 men analyzed in a single institution. Bother, to any degree, was experienced by 45% of men. That's almost half of men that said orgasm was affected in a way that bothered them. And 14% reported that their partner was bothered by it as well. So is climax or orgasm? Remember how we said you won't ejaculate fluid after surgery, but you'll still get the sensation. Now we're diving in deeper to the climax sensation. And you're hearing that can be affected too and can be distressing to men. At a median follow-up of 36 months or after radical prostatectomy, orgasmic function was worse in 60%, 60.1%. It was stable in 30.5%. And this is very interesting, and I've seen this in multiple studies, and this statistic is accurate to the other studies too. It's about what we find in other studies. It was improved or more dramatic in about 9.4%. Usually between 5 and 10% of patients and their partners will report a more intense orgasm after surgery. Now, we certainly wish that would happen in more patients. It is a small majority of patients because it's about 5 to 10%. Most men, as you can see from this study and other studies, say it's either diminished or similar, but some men have more intense climax, that's a good thing for those men. Now, when you see from my study and some other studies, again, orgasm changes. Orgasm can absolutely still be enjoyable and be present, but ejaculation can be, remember, that ejaculation or climax orgasm sensation can be diminished, absent, or it can be improved. So that sensation changes. Orgasm can be different or diminished or similar in most men. So the majority of men say it's either different or diminished, or it's similar. But a small percent of men, about 5 to 10%, say it's more intense and better. And we found that in our study as well. So what about penile shortening? We hear men talk about penile shrinkage, penile shortening. Well, what they think happens is, and so what is that? That's a decrease in penile length after radical prostatectomy. Men have talked about it for years. They have done research and they have found, yes, indeed, there is some things going on. The first occurrence is noted after the catheter is removed. And sometimes studies, quite a few studies have showed that as erectile function improves over time, at 6 or 12 months, that can change and resolve for some men, studies have shown. So even though you experience that in the beginning, it may resolve over time, and some men do experience that. If you don't get erectile function back, you can have atrophy leading to longer term over time feelings and a sensation and penile shortening or penile shrinkage that men talk about over time. We think it's associated to right after surgery, increased sympathetic tone. The muscles sort of tighten and pull in because of the surgery as a response to the inflammation, different things that are going on. Over time, we think it happens from lack of muscle activity, as I talked about earlier. And so some men who recover a fair amount of function or even partial function may not experience that because their muscles are moving back and forth as the penis goes from flaccid to hard to flaccid to hard, like it has their whole life. But men who don't experience that improvement may have a little bit more permanent shrinkage or shortening. And it's usually about 1 to 2 centimeters, which is about an inch or less. But some men notice it much more dramatically. Some men don't notice it as dramatically, and some men don't notice it at all. That's what the studies have shown. So if you're experiencing it, it is real, and those are the reasons why. And I hope that helps you understand it better.
Well, Jeff, it's been really great having you on the show today. It's a lot of great information for patients. Most important thing out there is don't forget there's options. Don't just give up. And catch us again next week for more on UroPatient.com.